Yeah, thank you so much, Naledi. So the former Health MEC Qedani Mahlangu was actually under cross-examination from Advocate William Mukari, who is representing the former Premier of Gauteng, Mr. David Makura, as well as the Gauteng Health Department then and also in its current form. I mean, did you know that Advocate Mukari was trying to get Qedani Mahlangu to take ultimate responsibility for the chain of command in terms of a letter or in terms of the instruction that was put down or handed down to start the process of cancelling the Life Esidimeni contract. So now, lady, just to give you some context of what the key arguments were around yesterday. So in early November 2014, there'd been a meeting with the then Premier, Mr. David Makura, as well as the Provincial Budget Committee. And at that meeting, it had been highlighted and raised that the Gauteng Department of Health had been overspending and was over budget and needed to cut some of the programs that they had. These were about 12 programs that they had. And they said that one of the programs of those 12 had been Life Esidimeni. And she'd been instructed to then go to the Health Budget Committee and give them the information that had been discussed at the provincial level. On the 26th of November 2014, she then went to the PBC and gave them the information to say that the department was overspending and that one of the big budgets that had to be cut was the 300 million rand contract that had been given to Life Esidimeni, obviously, and that contract was to deal with patients that were mentally unwell or young children that had some sort of physical illnesses or restrictions that didn't allow them to move freely, as well as frail care centers. So it's quite a number of different Life Esidimeni centers that were part of that 300 million rand contract that was being run by the Life Esidimeni group. And she told that PBC meeting that 300 million rand had to be, contract had to be cut in some way or form. And this is what led to the chain of command happening, then the 3,000 mental health patients being moved to different NGO facilities, because they'd rationalized at that meeting that moving those patients to different NGOs would be a cheaper alternative for them, and it would be easier for them to be able to make payments. But the problem was they hadn't actually properly vetted those NGOs that they were sending the different patients to. They hadn't vetted whether or not those NGOs had sufficient medication for the different patients that had different illnesses. They hadn't checked whether or not those NGOs were properly fit and equipped to be able to take care of those. Quite a number of the patients were on wheelchairs, and a lot of the NGOs didn't have access or accessibility to those wheelchairs. Nor were there people who was the staffing itself, nor were there staff that was competent or qualified to take care of people who really had special needs and had to be taken care of. And this is what Advocate George Mukari was trying to point to, that she ultimately was responsible and cannot now then say that she was not part of the decision making, she did not hear the audio correctly, a litany of excuses, blaming the Premier for being the ultimate highest body responsible for putting that whole process of the relocation of the 3,000 Life Esidimeni patients to different NGOs. And he was saying that she also needs to take responsibility. She is also culpable because at every single key milestone point in the process of relocating those Life Esidimeni patients, as well as cutting the contract from Life Esidimeni, she was a critical part of it. She had been informed every step of the way. And this is what the criticism has been of the former Health MEC, that she seems to be throwing the blame to either the Premier's office, to either her HODs, to either the CEOs, or either to the NGOs. But it doesn't quite might seem in her testimony, it hasn't come out yet or hasn't come clearly enough in her testimony, what she did to try and address the issues as they were raised. We know that the NAHAU had written letters to the Premier saying that they are concerned about the complaints that are coming from the NGOs, that are coming from the healthcare sector and from the healthcare workers about the conditions that the mental health patients were facing and were dealing with subsequent to the 2014 move in 2016, and how the quality of life and care had deteriorated, Naledi. So it was quite interesting to really get that, and she still did not own up to any culpability or show any sort of remorse for her part in that, Naledi.